Recommendations when it comes to sunscreens is often to look for the words broad spectrum. And now I have to say, because I've been in practice for 20 years and I really sit down and think about my patient's experience, because if I'm going to give a recommendation and they're going to go to a store, I need to make sure that they can get what I recommend, because if it's not available or it doesn't make sense, it's a useless recommendation and a waste of both of our times to even talk about it. So one of the things I have found in that category is the words broad spectrum, because what bothers me about that is that when we had our research interns sit down and catalog well over 400 varieties available of sunscreen in our region, in the Philadelphia region, 100% of the sunscreens, whether they had an SPF of 4 or 100, had the words broad spectrum written on the side of it. So from my perspective, one, that's a waste of breath to talk about the words broad spectrum, and two, it's a meaningless claim, because ultimately the words broad spectrum are really intended to tell us that there are ingredients in your product that effectively block your skin from UVA light. UVA light is that spectrum that may not burn your skin, but it does put you at a higher risk for photosensitivities, and that's a really important concept because we're learning more about what that means, as well as discoloration of the skin. When we're treating patients with pigmentary disorders or pigmentation that bothers them, say with melasma, discoloration from various inflammatory conditions, then we need broad spectrum coverage. That's effective broad spectrum coverage. So broad spectrum doesn't tell us a whole lot, because if it doesn't have enough of those ingredients to effectively block UVA light, the question is how much coverage are you getting? When we looked at, say, for example, there was an SPF of 4 that we came across, which was surprising to me because, again, I didn't even realize some of these exist until you go out and look for them. The SPF of 4 had the words broad spectrum on there, and there was 2 different brands with this. Their avobenzone is what gives them the ability to say that they're broad spectrum. Avobenzone is an ingredient that is something that's added to products to give UVB coverage, but also can provide UVA coverage. But technically it is it's unstable in light, so it always needs a photostabilizer with it, which is usually octocrylene. So you'll see both ingredients together. It's really hard to say how much UVA coverage you're getting from it. They both had concentrations of 1% of avobenzone. Through the literature and try to determine how much avobenzone you need in a product to give you effective UVA blockage. There's a few articles out there that suggest an avobenzone concentration of 3% or a zinc concentration of at least 5% is necessary to get adequate UVA coverage. But again, it's hard to say how much you're getting out of the 1% then, because it's clearly not 3%. And if you're applying these, then I worry that, of course, that you could be getting exposure to UVA light that has its own challenges. So when we broke our list down further to look at which sunscreens had an avobenzone concentration of 3% or a zinc oxide concentration above 5% or both, what we found was actually it was only about 274 out of the 412 sunscreens that we cataloged that had that concentration in there. So I'd say, even though that's pretty good, meaning that I'm happy to see that those concentrations are there, it tells you that only 66% of those sunscreens actually had the amount of avobenzone that I think would be necessary to comfortably talk about broad spectrum coverage, as opposed to 100% of sunscreens that are labeled as such. Your concerns are sensitivities to the sun based on autoimmune conditions, or say you're on medications that make you sensitive to sunlight, like blood pressure medications, which are very commonly used, or for example, you're dealing with pigmentation challenges and you need a sunscreen that's blocking effectively broad spectrum, like truly broad spectrum, that gives you adequate UVA coverage, then you need to really focus in on those concentrations of the ingredients, as opposed to just choosing one that says the words broad spectrum, because that's somewhat meaningless now.